بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Today we will discuss Legionnaire disease. It is a work-related infection by Professor Mahmoud Hani Sulaiman. What is Legionnaire disease? Legionnaire disease is a common name for one of several illnesses due to Legionnaire disease bacteria, LDB. Infection of lungs is a form of pneumonia. More than 36 species of Legionella identified and more than 20 linked with human diseases. Same bacteria also may lead to flu-like disease called Pontiac fever. LDB. What are LDB? What are the sources of exposure and transmission? First identified Legionella in 1977 as a cause of outbreak pneumonia, which led to 34 deaths at 1976 American Legion Convention in Philadelphia. Pneumophilla undoubtedly lead to previous pneumonia outbreaks, but with slow growth and needs special growth environment. A species of Legionella associated with cases of Legionnaire disease called Legionnaires disease bacteria. This is the Legionella pneumophilla bacteria, rod and flagellated. It is a gram-negative rod, 14 serogroups, produces catalase and beta-lactamase, and so not sensitive to penicillins. Other species of Legionella may lead to legionellosis, but Legionella pneumophila lead to majority of cases, mostly by 1, 4, and 6 serogroups. Legionella is also implicated in wound infections, pericarditis, and endocarditis without presence of pneumonia. What are sources of exposure and transmission? Any warm water divided into aerosols, spray, or mist. Any warm water system or device, including non-made or natural, that disseminates water as aerosol, spray, or mist. يبقى any warm water, and it is in the form of aerosol, spray, or mist. LDB widely present at low levels in natural water. However, levels of LDB found in natural environment are so low that it is unlikely individual contract disease from these sources. Risk of exposure increase when high concentration of organisms grow in water systems. Domestic potable water, plumbing systems, cooling towers, and warm, stagnant water, all these can provide ideal conditions for growth of organisms. What are sources of exposure and transmission? Inhalation and aspiration. Inhalation of aerosols, fine spray or mist, or other microscopic droplets of water contaminated with LDB. Aspiration may occur when choking or spontaneously during drinking, ingesting, swallowing process. This will lead to oral fluids and particles to bypass natural gag reflexes and enter into respiratory tract and lungs instead of esophagus and stomach. There is no evidence that diseases transmitted from one person to another. What are incidence rates and risk factors? This is important. Contracting Legionnaire disease depends on level of contamination in water, susceptibility of exposed person, intensity of exposure. Legionnaire plus or minus 50% of people exposed. In US, it is fairly common and serious. LDB are one of three top causes. Non-epidemic community-acquired pneumonia, about over 25,000 cases per year, lead to 4,000 deaths in the US. Difficult to distinguish this disease from other forms of pneumonia, so many cases go unreported. Risk factors. It is opportunistic disease. Attack individuals with decreased immunity. Most susceptible include elderly, smokers, immunosuppressive treatment, those with COPD, organ transplant, corticosteroid treatment. Emphasize that relatively healthy individuals can be at risk of contracting disease. What are the symptoms? Fever, myalgia, cough, pneumonia of the diffuse and lobar types. Pontiac fever is a milder disease without pneumonia. Incubation period 2 to 10 days. Symptom. Early symptom, slight fever, headache, aching joints, muscles, lack of energy or tiredness and loss of appetite. Later symptoms, high fever, may reach 41 degrees centigrade, cough in 75%, dry at first, late producing phlegm, difficulty in breathing or shortness of breath, chills, chest pain. Common GIT symptoms, vomiting, diarrhea, nausea and abdominal pain. Mortality rate may reach 20% despite adequate treatment. Clinical clues suggestive of LD. Diarrhea, fever more than 40, numerous neutrophils but no organism by gram stain of respiratory secretions, hyponatremia, serum sodium less than 131 milliequivalent per liter, non-response to beta-lactam and aminoglycosides, illness in environment containing water contain LD, onset of symptoms in 10 days after discharge from hospitals, may be due to AC in the hospital. Pontiac fever, non-pneumonia, incubation period shorter, it is about 3 days. Full recovery occurs 2 to 5 days without treatment. No death is reported. Pontiac fever produces flu-like symptoms, e.g. fever, headache, tiredness, loss of appetite, muscle and joint pain, chills, nausea and dry cough. Pontiac fever with exposure to non-viable LDB and may be a hypersensitivity response to bacterial or other antigens rather than an infection. How it is diagnosed? PH, public health, defines a confirmed case as a physician's diagnosis of pneumonia based on chest X-ray and lab test results. Lab test is necessary. Isolation of LDB, fourfold increase in immunofluorescence antibody IFA titer, detection of L pneumophilla serogroup 1 and radioimmunoassay or enzyme-linked immunosorbent assay may be used. X-ray, all patients show pulmonary infiltrates at time of presentation, non-specific picture. Third of cases show pleural effusion. Culture antigen testing of pleural fluid mostly positive. Immunosuppressed patient may show rounded nodular opacity, which lead to decrease ancoalescent and cavitate, leading to an abscess complete clearing of pulmonary infiltrate in 1 to 4 months. This is chest X-ray in 52-year man presented with pneumonia, then diagnosed as Legionnaire disease. Patient was cigarette smoker with chronic OPD and alcoholic cardiomyopathy. He received glucocorticoids. Left shows baseline X-ray, show long-standing cardiomegaly. Center admission X-ray show new rounded opacity. Right X-ray taken 3 days after admission during treatment with erythromycin. This X-ray adult with pneumonia due to Legionella pneumophilla. Legionella infections are rare in healthy children, but nosocomial infections and hospital outbreaks are reported. This infection is not transmitted from person to person. Man with severe pneumonia due to Legionella. Lobar consolidation of left lower lung lobe. Mild pleural effusion in chest X-ray A and high resolution CT in B. A week after hospital entry, repeat high resolution CT of chest showed extensive homogeneous consolidation of left upper and lower lobes accompanied by bilateral ground glass opacities. Ground glass. Treatment. LED treatment requires use of antibiotics. Early treatment decrease severity of symptoms and increase recovery. Drugs of choice are macrolides. They include azithromycin, erythromycin, and clarithromycin. This is the doses of these antibiotics and the route and the frequency of giving them to the patient. Azithromycin, clarithromycin, erythromycin, doxycycline, and rifampicin. Please print this slide and use it in your clinic. Prevention. Disinfection of water supply is ultimate preventive measure. Only two methods proved reliable and cost effective. First, superheat and flush method. Second, commercial copper and silver ionization method. Notabene, hyperchlorination is no longer used. Only two methods, superheat and flush method. This requires heating of water so that distal outlet temperature is 70 to 80 degrees centigrade, then flushing of the distal outlets with hot water for at least 30 minutes. Commercial copper silver ionization method. Notabene, OSHA recommends a level 1 investigation when there is evidence of exposure to LDB. This will be given. OSHA recommends a level 2 investigation when more than one confirmed or possible case of Legionnaire disease is present in the facility. Possible sources. These are the possible sources. This is the picture of the possible sources. Cooling towers and evaporative condensers and fluid coolers. Cooling towers, evaporative condensers, and fluid coolers. Ideal temperature range for Legionnaire disease bacteria growth is 20 to 50% degree centigrade. How to investigate a suspected outbreak due to this bacteria? Any physician work in a place with AC must have a copy of this in his desk, copy of how to investigate suspected outbreak. If he found many cases of pneumonia inside the place he works in and the place had an AC, he must use these rules to investigate the place. First, review worker absences to detect other cases. Please print this and use it. Please print it and use it. Review worker absences to detect other cases. Continued. This is how to set a program to investigate the many cases of pneumonia in your workplace. Please print this and use it. The program is still given. Please print this and use it. The program is still given. Please print this and use it. If the potential case occurred recently, a urine antigen test may detect Legionella, serogroup 1 antigen. A positive urine antigen test for a diagnosed pneumonia case تساوي confirmed case. Collect sputum, lung tissue, or lung aspirates from currently symptomatic individuals for LDB culture. A positive culture equal Legionnaire disease. Disease confirmation: more than one case of disease, then the facility should be considered to have outbreak. See outbreak response. Note, I just told you about it. The immediacy of the action will depend on whether the outbreak is going or occurred 30 days or more in the past. Prompt action is a must. Continue medical surveillance for the workforce and identify if water source responsible for the outbreak. A sample program is still given. Please write it and put it in your desk. Please type this and print this and put it in your desk. What actions are required when an outbreak has been confirmed? Again, any physician work in a place with AC must have a copy of this in his desk. Outbreak of Legionnaire disease exists when two confirmed cases of disease attributed to building or part of a building in a 6-week period. When two or more cases are attributed to building or part of building in a 6-week period, this means outbreak. At least one of cases within last 30 days, assume that outbreak is still present. An outbreak requires a high priority investigation and immediately initiating control measures to prevent additional exposures to all water systems that have a reasonable potential for contamination and worker exposure. Outbreak response: the following actions are used to abate the threat of further infection in the building in which an outbreak of Legionnaire disease occurred. Evaluation and isolation: relocate high-risk individuals, inspect facility and collect water samples, conduct investigation, control actions, prevent additional exposure. Evacuation and isolation: relocate high-risk individuals. Under most circumstances, evacuation of building is not recommended. However, with confirmation of an outbreak, individuals with compromised health conditions should be considered for removal from the implicated building. Individuals at high risk for contracting disease include immunosuppressed people. We repeat this again: immunosuppressed people, organ transplant patients, chemotherapy patients, including those on corticosteroids, individuals if a physician judges them with poor health. Inspect facility and collect water samples. Please print this. Please print it. Water sampling. How to do water sampling? Please print this. Control actions: prevent additional exposure. Assume that all potential sources of contamination are contaminated and treat them accordingly. This includes hot and cold domestic water, cooling towers, humidifiers, and any other potential source of water exposure. Control actions: need not require facility shutdown. They need not require facility shutdown. Temporary provisions including the following: supply bottled water for drinking, shut down water heaters, use temporary cooling towers to allow work to continue, prevent additional exposure, shut down. A member of the building maintenance engineering staff or expert outside consultant who has a working knowledge of the system design and current operation can explain how the water system operates and the proper procedure for a controlled shutdown. Treatment. Treatment of potential sources of contamination following inspection and water sampling is described before. After treatment, collect and analyze water samples for CFU of LDB to determine effectiveness of treatment. Upon reuse of water system following treatment, maintenance and water sampling are essential to ensure that maintenance continues to be effective. وفي النهاية لا أجد إلا أن أقول الحمد لله رب العالمين و thank you for your listening.